Georgia Department of Public Health School Nurse Dental Screening Training, Form 3300. My name is Kimberly Lewis. I'm a general dentist and I will be presenting this training today. The training was actually prepared by Carol Smith, a dental hygienist with the Georgia Department of Public Health. The purpose of this training is to provide school nurses with the background material and the education that they will need to perform the basic dental screening on the Form 3300. What we're looking for when we examine a child's mouth is we're looking for decay. And we also want to take a look at the soft tissues. We want to get some idea what the hygiene is like. We want to see if there's injuries, if there's signs of neglect or abuse. It's just a visual examination of the teeth and the mouth and the soft tissue, and then we proceed from there. Oral health is important, and we can all be an advocate and a resource to improve oral health. A child that has decay or an abscessed tooth is not going to be ready to learn, and that child needs treatment. So this is everyone's responsibility to be able to assess the situation and make appropriate referrals. In 2000, the Surgeon General did a report on oral health, and he called dental decay a silent epidemic. And this report was very enlightening. It was the first time a Surgeon General had done a report on oral health. And I would suggest that if you have the opportunity that you pull it up and take a look at it. What we do know about dental disease, such as cavities, is that it is preventable. It does not go away. It's very expensive to treat, but it's very inexpensive to prevent if parents know what to do and what to look for in their child. One of the things that came out in the Surgeon General's report of 2000 was that tooth decay is currently the single most common chronic childhood disease. It's actually more common than asthma and more common than hay fever. And remember now, this is entirely preventable. Dental problems can greatly reduce a child's capacity to succeed. Tooth pain makes it difficult to eat, sleep, focus in class, and these problems disproportionately affect children from low socioeconomic backgrounds. Studies have shown how important oral health is over the years. There has been a connection between oral health and systemic diseases such as cardiovascular disease, periodontal health, and diabetes, and better overall health will lead to better systemic health. When we look at the mouth, we want to take a look at the oral structures. That would be the teeth and the gums. We can also look at tooth eruption, and we want to check for dental caries or cavities. This slide shows a picture of some of the normal oral structures. You can see a picture of the healthy teeth and gums. You notice that the gums are, well, they look a little red in this picture, but the gums are actually pink and they fit up close to the teeth, and they're not puffy and they're not swollen. And when we look in the mouth, you can see that the tongue, this is what we're looking at, a normal tongue, and you can see the tonsils in the background. This is a normal appearance. And this is what a normal tooth would look like. It does have some anatomy to it. And we also see a cross section of the tooth here. The top part of the tooth, the white part of the tooth, is the enamel. The middle part of the tooth is the dentin, and the inner part of the tooth, the nerve, is called the pulp. And that's where we get our sensation from. That provides the sensation of pain or hot or cold. It comes from the pulp of the tooth. Now, this is a better picture that shows the pink gingiva. It's sort of stippled like the peel of an orange, and it should fit up sort of firmly against the teeth. And then you have the mucosa, which is the pinker area a little bit lower. Now, the gum should come up in between each teeth, and it should have a scalloped appearance. Typically, the children that we're going to be seeing will have 20 teeth. They'll all be baby teeth. And as the child ages, they will eventually have 32 teeth. The adult teeth are already present when the child is born. They're called tooth buds. And on an x-ray, they can be seen. This is one reason why it's very important to take good care of the baby teeth, because the permanent teeth are already there in place. And this is your typical eruption schedule. Most infants will get the first tooth between 6 and 10 months, and typically the last tooth just before age 3. The eruption schedule is important just so that we can see if all the teeth are in place. Also, between ages 6 and 7, this is quite important. A child usually will get their first permanent molar. Now, the molars do not push any of the baby teeth out before they erupt. So a 6-year-old may not have lost any teeth and is already getting in their first permanent molars. And if we have not established good oral hygiene in that child by this time, then they could have a decayed permanent molar very quickly. The formula for decay is pretty easy. It's sugar that we eat in food plus bacteria plus time. And what it does is it breaks down the enamel, which is the outer covering of the tooth, the hard tissue of the tooth. It breaks it down and makes a little hole, which we call a cavity or decay. The bacteria that comes from, the bacteria that causes tooth decay, actually, Streptococcus mutans, can be transferred from one person to another. So it is important for parents not to kiss their child on the mouth or not to share a toothbrush or things like that with their child. We all form plaque on our teeth every day. It just builds up in our mouth and there's nothing that we can do about it. It's like dust collecting on a tabletop. It's going to form every day, and it's a sticky bacterial substance. And what we have to do is we have to remove that substance every day. This is very important. It's particularly important for children because they don't know how to brush well. So a parent needs to help with that process of brushing. And also, if the child does not brush well before they go to sleep, some children will sleep possibly 10 hours a night, and that food and that plaque will just sit on their teeth. And that's when it becomes very acidic and can eat through the enamel of the teeth and cause tooth decay. This is just talking about the bacterial component of tooth decay. And there are some people, almost everyone will have some Streptococcus mutans in their mouth, which does cause tooth decay. But not everyone will get tooth decay from the Streptococcus mutans, and that has a lot to do with our oral hygiene, a lot to do with our diet, and also how often we're putting food into our mouths. So the transmission of bacteria can occur from child to child and can occur from caregiver to child, such as sharing drinks, mommy kissing the baby on the mouth. And this is what we want to watch for and warn the parent about. This is why it's very important for parents to take their children to the dentist starting very early in life. At the eruption of the first tooth is what we recommend. And then we can give that parent guidance on how to proceed. This is very important so that they don't develop habits that, unbeknownst to them, are bad for the teeth. So before a cavity ever gets started, first the acid and the bacteria have to combine, and they have to sit on the teeth for a certain period of time. And what that does is it demineralizes the enamel of the tooth. And sometimes you can see in the mouth where this demineralization has taken place. The enamel will appear sort of chalky white, and we have a picture coming up in a couple of slides. And while a cavity has not formed just yet, this decalcified, we call it decalcified enamel, is a weakened enamel, and that is where a cavity will most likely form if habits are not changed. And you can see in figure A the white chalkiness that I'm speaking of. That's from plaque being left on the teeth routinely in that same spot over and over again. Well, eventually a small lesion will form there because the enamel is weakened. And then figure B, you can see that the enamel has been penetrated. There is a cavity there. And in figure C, the cavity has been left untreated and has resulted in the death of the nerve of the tooth, and you can see a dental abscess. Abscess is created when the decay reaches the nerve of the tooth. When that happens, the nerve cannot repair itself. It will start to die, and pus and byproducts will be released from the root. The nerve will start to break down and die. That's why it is so important to get to tooth decay early. This is just another picture here of the demineralized enamel or decalcified enamel, and you can see that it's basically impacting this person right around the gum line. That is where people tend to leave food when they brush. They'll brush the tops of their teeth or the chewing surfaces of their teeth, but they don't get the area that is right next to the gum line. And it's important not to leave food there or you will get decalcification. This is also common in people who have braces on their teeth. They have to clean below those brackets to make sure they're not leaving food sitting, plaque sitting for days and days at a time. Some of the risk factors for decay, possibly a child with special needs, dry mouth, if a child is on medication that is causing dry mouth. Sometimes we have children that have medical needs and they are on a high sugar diet. That is not good. A high sugar like products like Ensure or things like that, to nutritional supplements that are very high in sugar. Braces can be a risk factor for decay. A lot of snacking is a risk factor for decay, constantly eating. It's important to just stick to 3 meals a day, possibly 2 snacks. But if you're going to eat all day long, and sometimes we see parents, their children constantly are snacking, your teeth never get a chance to recover. So these are some of the things that can increase your risk for dental decay. Baby teeth are important. They're important for speech. A child that loses their teeth early sometimes is not able to pronounce words correctly or make the correct sounds because your tongue is needed to push up against the back of your teeth for certain sounds. It also supports the structures of our face and our lips. But most importantly for young children is that the baby teeth are actually holding the space open for permanent teeth. If a child's baby tooth is lost early, prematurely, due to tooth decay, then the teeth will end up shifting. And the permanent tooth is not going to come in any sooner just because that tooth was lost. And if the teeth shift, then the child may not have enough room for the tooth to come in when it's time. The baby teeth will not complete the exfoliation process. That's when the child sheds the teeth. That will not be complete for most children until between ages 10 and 12. That's another reason why it's very important to take care of the baby teeth. They last more than just a few years. They have to be healthy for 10 to 12 years. Tooth decay can result in pain. If you recall the picture of the slide previously where the nerve was impacted due to the tooth decay, well, in this picture you can see that this child's nerve was impacted. She has an abscess and products are being released, pus, through the bottom of the root, and they don't have anywhere to go, and so she has the facial swelling. Another problem with this is, while not common in this country, it has happened before, that this dental abscess, this bacteria doesn't have anywhere to go. And it must be treated with antibiotics, and eventually the tooth will need to be removed. But the bacteria can travel through the planes of the face. The bacteria can possibly travel through the brain. If that does happen, death can be a result of that. There was a child here that died in Maryland due to untreated tooth decay from a dental abscess that traveled to the brain. So it is important to get these things taken care of right away and to refer. So the cost of waiting. A child has a cavity, they go to the dentist and they can have a filling done and that's it. But a child or even an adult with a large filling that hasn't been treated, now we may be looking at a root canal and a crown, and it is much more expensive. This holds throughout the lifetime of your teeth. It is always better to go to the dentist earlier, and the dentist is going to be able to detect tooth decay much faster than you waiting for something to hurt you. Now, we talked about tooth decay. Another problem that we find in the mouth is gingivitis. Now, I told you that plaque usually forms around the neck of the tooth, close to the gum, and you can see in this picture that that's exactly what has happened. Plaque is formed around the neck of the tooth. Over time, this will irritate your gums. Your gums feel this is a foreign object in the mouth, and they don't like it. Your gums become swollen, puffy, and inflamed. You can see the red rim. They will actually bleed more easily, and they will start to pull away from your tooth. Gingivitis is typically caused by poor oral hygiene, and it can progress toward periodontal disease if hygiene is not improved and regular cleanings are not obtained. Sometimes a young child will present with red and inflamed gums. It's difficult to brush, everything hurts, and they may even possibly have a fever. This is usually primary gingival stomatitis. Sometimes it is transmitted from an adult to a child. The initial infection will look like this. Subsequent infections will usually present in the form of a cold sore on the mouth. So if an adult with a cold sore kisses a child, this could be the result. It can be treated at the dentist. And ANUG, or acute gingival necrotizing gingivitis, is just a bacterial infection of the mouth, and it attacks the gums. It's very painful. The breath has an odor and must be treated at the dentist, and the cleaning is one of the components of this. So now we're going to talk about the screening for oral disease in the Form 3300. The Form 3300 now, the screening is just a visual examination. But this visual examination is very important. Sometimes children present to kindergarten and they have not been to a dentist before. And this gives the nurse or the hygienist or whoever is looking in the child's mouth, it gives us the opportunity to really intervene and ask, has the child been to a dentist before, and get them to some treatment. We don't want to wait till the child has dental decay before they see a dentist. So the Form 3300 is the screening that is required for every child that is entering public school in Georgia. And the screening will address vision, hearing, teeth, and nutrition. And the purpose of this is to detect problems early so that that parent and child can get the assistance that they need. It is important to let the parent know that this is a visual examination only. This does not in any way substitute as a dental examination at a dentist's office with radiographs. While a school nurse may be able to look in the mouth and not see decay, even a dentist may look in the mouth and not see decay. Decay could still be present on radiographs, those are the x-rays, which could show decay in between the teeth. So if a child is not seeing a dentist regularly, they haven't been to the dentist within the last 6 months, it is important to provide them with information on how they can find a dentist for their child. And this is just a picture of the form. This is actually the form, the older version of the form with the dental screening box. The form has been updated for 2014, and this is the newer version of the form, which has added nutrition screening as well. The tools for screening are pretty basic. You might need a light source, some gloves, possibly gauze, tongue depressors to look in the mouth, form for documentation. It's your basic supplies that you should have available. It is important when you're doing the screening to wash your hands before doing the screening, before putting on gloves, and to change gloves in between. And you always wash your hands as well after you take off the gloves. So you want to start with the face when you have your oral screening with the child. You want to look at the face, then you want to make sure that you're not seeing any swelling, that it looks symmetrical. Look at the lips for any lesions. Then you ask your child to open the mouth, tilt the head back, and take a look at the roof. You shouldn't see any lesions there, the throat and the tonsils. And then you want to look at the teeth. And you want to make sure that you're going in some sort of pattern so that you're not, some sort of order so that you're not missing anything, possibly starting with the upper arch from right to left and then the lower arch. Now the classifications of the oral screening, sometimes children will not cooperate for this procedure and you're just not able to get a good look at the teeth, then you're just unable to screen. I would suggest to the parent that they try again at the dentist's office within 3 months. Some children are just not as mature as others, but typically you keep trying, we will be able to get good results. Normal appearance means that nothing abnormal was noted. And needs further evaluation means that you've seen some suspicious areas. Perhaps they're just dark spots on the teeth that you've seen. Perhaps you've just seen the white decalcification, or you've seen open cavities, open small cavities. Now, an emergency problem would be that the child has complained of pain in the past, or the child has large cavities, or perhaps you look in the mouth and the front teeth, all you're seeing are the roots of the front teeth. That would be emergency problem. And under professional care, this would be a child who is seeing a dentist and still has cavities and possibly has some restorations, but is currently in treatment. The classifications of the oral screening, these correspond with what's available on the form. Unable to screen means the child was uncooperative, they were just crying, they wouldn't sit still, they wouldn't open their mouth, you weren't able to get a good look. Normal appearance means that you did look in the mouth and you didn't see anything abnormal. Hygiene looked normal. You didn't see any dark spots on the teeth. Needs further evaluation means that you saw some small areas. Perhaps you saw some decalcification, the white areas on the enamel that I spoke of, or you saw small brown dots on the teeth, or small cavities that were more open. Emergency problem observed means that you saw large cavities open and the child has complained of pain before, or perhaps even the front teeth, the crowns of the front teeth are gone and you're just seeing the root. Now, under professional care means that the child is currently undergoing dental treatment. You may see decay in this situation, a child who's still in treatment, but you may also see some restorations as well. In all of these classifications, except for under professional care, the child needs to be referred to a dentist if the parent has indicated that they do not have a regular dentist. So to conduct the oral health screening, a medical provider needs, and we discussed this before, some sort of light source, some gloves, preferably non-latex. There are some people that have a latex allergy, a tongue depressor, a mouth mirror. A dental chair is not needed. You can just have the child tip their head back and take a good look in the mouth. The dental examination can be done by a dentist, a hygienist, a public health school nurse, a private practitioner, and physician as well. So we want to lift the lip when we're looking, and you can see here this child looks to me like they have some decay. This is where the teeth were decalcified and starting to break the enamel. Sometimes you'll see this, and this is quite common in young children because parents leave them on the bottle for too long. I didn't mention that earlier, but we should start weaning children off, the babies off the bottle at age 1. And they also will put them to sleep with the bottle at bed, give them the bottle at bed, and have them fall asleep with the bottle in their mouth. There is sugar in milk. There's also sugar in breast milk. And to have it just sit against the teeth all night is not good. And so children that typically have their front 4, upper 4 anterior teeth decayed is usually from baby bottle tooth decay. Now here you see the picture of healthy appearance, very nice. The teeth are clean, the gums are not puffy. We do see on the right side of the screen, we see the white decalcification that I spoke of. Usually that's around the gum line. And we do see a stained groove. You can see the little brown spots. Now, whether that's decay or not, that person needs to be referred to the dentist to determine that. And you'll also notice in the lower left that we see a child that has a darker pigmentation of the gums. There is nothing abnormal about that. It does not even need to be mentioned, but it's for your own information that the gums can come in all different colors, just as skin color does, and they are still healthy gums. They're firm and they're up around the neck of the teeth the way they're supposed to be. It's just another sign of the white spots and leading to the little brown spots. This will be an example of needs further evaluation. This child clearly has some small decay starting, and that's probably from staying on the bottle too long. Also sugary drinks, and the sippy cup can do the same thing, quite a bit of sugary drinks. These are other examples of needs further evaluation. You can see the little small brown spots. These are cavities, and you can also see in the center, the lower slide, the little opening right in between the teeth. That's the kind of cavity that's going to show up on an x-ray. This is why it's important that a child get to the dentist and have x-ray. The little white fillings, they could be temporary fillings or they could be sealants. Those are all not meant to, if it's a temporary filling, they need to follow up with the dentist to make sure that's taken care of. And then you can see on the right the very large decay. I think I would include that as needs immediate treatment. Other examples of needs further evaluation. In children, you're going to see a lot of decay on the front teeth if they have poor oral hygiene and they drink a lot of sugary drinks. Now, these are our emergency problems. You can see the swelling clearly without ever looking in the child's mouth. You can see that they need to see a dentist right away. This is a dental abscess. It's very important to get treatment with antibiotics. You can see in the center shot how decalcification has just eroded the teeth from the gum line up. And then the lower picture in the center, that's a picture of bottle mouth. You can see that the child's been on the bottle for a long time. Sometimes this is not uncommon in other people coming to this country from other countries. They may keep their child on the bottle longer, and sometimes I have seen children on the bottle up until age 2 or 3. It is very detrimental to the teeth, but sometimes the parent is just not informed that that's not what they should do. Now, on the right side of the screen, you will see a picture of a dental abscess. That's how it will look in the mouth. This may or may not cause facial swelling, but you can see it's starting to swell inside the mouth. And these are examples of early childhood caries. We consider early childhood caries, tooth decay, more than one cavity in a child that's age 4 is going to be early childhood caries. A child at that age should not have dental decay, particularly if they've been on the proper diet. This is preventable. This child will need quite a few extractions. So after the screening, the most important thing is to convey to the parent the importance of regular dental care and seeing a dentist. Now, some parents will say that they can't afford a dentist, so it is important for the school nurses that have access to a resource that they can provide the parent, perhaps a handout of agencies that provide low-cost dental care in that particular community. I know that is not always available throughout the state, but certainly in the major counties, Fulton, DeKalb, and Cobb, Gwinnett, dental care is available to young children and that may not be able to afford care at a private dentist. I hope that after this presentation you feel more comfortable looking into the mouth and especially referring the parent on and perhaps even giving a little guidance on getting off the bottle at an early age. And it may not be the child that you're actually seeing. Perhaps you're screening a child and the mom is sitting there with a young one, a baby in her lap who's still on the bottle. So I think we can all be an advocate for oral health care. It is important. It certainly is preventable, and it's just the right thing to do. So I hope that I've provided you with enough information where you will feel comfortable providing the dental health screenings. Thank you.